Good morning. It's an experience being here and seeing all the empty chairs, but thank you to everyone who's logged in, and also to those who'll be watching the archives. Can I have the first slide, please? Like Pastor said, we're going to be talking about mental health and COVID-19. Everybody has been impacted in one way or the other. And in my lifetime, I've never heard of or experienced anything on such a global scale that has almost brought everything to a grinding halt. Next slide, please. Next slide, please. One of the things we're going to talk about today is stress. We're going to talk about stress, and we see here that stress is it's a state of mental or emotional strain or tension resulting from adverse or very demanding circumstances. It's pressure or tension exerted on a material object. Now, stress can be either good or bad. There's good stress. Good stress makes you grow. Good stress, it stretches you. It makes you develop yourself. It makes you gain new skills. It makes you adapt. But we're going to be talking today about bad stress. Next slide, please. So we're going to be talking about it in a medical or biological context. Stress is a physical, mental, or emotional factor that causes bodily or mental tension. Stresses can be external, and they can also be internal. Next slide, please. So, in the midst of this COVID-19 pandemic, we need to be very, very careful, because when we hear, read, or watch the news about the outbreak, even if it's not close to us, even if we're reportedly not at risk, it can stress us out. If we continue listening and bombarding ourselves with all those negative images, negative reports, and the fact we're watching the stock market, I had to tell my husband, just stop looking at the investments, because he's always like, should I sell? Should I sell? I'm like, no, just shut it down. You're not retiring now. You have no reason looking at your 401k. Just shut everything down and ride out the wave. Next slide, please. So some of the things that are causing stress at this time are the fear of being infected by the disease, the fear of becoming a host and transmitting it to others, job loss, uncertainty, income loss, especially for contractors at this time. They don't work, they don't get paid. They're not salaried, they don't have benefits. So especially for contractors, this is a very harrowing time. There's the fear of running out of food and supplies, because there's some places that they're completely shut down and everyone is wondering, are we next? Right now there's shelter at home, you can still go to the groceries, but what if they shut down the grocery stores? What if they shut down the pharmacies? What if everything comes to a complete halt? How are we going to survive? Then the children, the school closures, especially for the seniors, the high school seniors, the college seniors, they're panicking right now. They're not sure. There's so much uncertainty out there. And on top of that, when you add the social distancing, especially for someone that already had a pre-existing mental condition, this is not a very, very good time. This is not a very good time. And even with the social distancing, there's some people that are now locked up in the home with their abuser. So that there's no relief. They cannot get out, they cannot reach out. Nobody says she has a black eye or a broken arm because she's home, and nobody else is coming to the house. So this is a very, very hard time. And because of this, people are really stressed out. Next slide, please. So we want to talk about some of the signs we need to know. We need to know the signs of stress so that we can monitor our own mental health, and we can also help monitor those who are home with us at this time. We need to know how to relieve stress, and we also need to know when it is time to get help. So when you look at this, this slide, you can see it's divided into 4 sections. There's the body, there's the mind, behavior, and emotions. So stress manifests in each of these 4 areas. So some of the ways that it manifests in the body through having headaches and other pains, losing your appetite or eating too much, sweating and having chills, tremors, muscle twitches, and being easily startled. So those are some of the physical symptoms. So that's some of the things we see. And when you look at these symptoms, those are the kind of things that will, on a regular day, will make one go to the ER or go to the doctor and not realize that the underlying factor is stress. But we're just treating the symptoms, not addressing the issue. So it's going to come back. Then when you look at the mind, some of the ways that we manifest stress are having trouble remembering things. I mean, we joke about it. Oh, I can't find my keys, I can't find my glasses, I don't know where I put this, I don't know, but sometimes it is a sign of stress. Feeling confused, you can't decide, you're just confused, you're not sure what to do. Having trouble concentrating, easily distracted, having difficulty making decisions. These are some of the ways that the mind alerts us to the fact that we are under stress. Now the next box, emotions. Some of the ways in which we manifest stress emotionally. We become anxious or fearful. We feel depressed, we feel guilty. You feel guilty. Oh, both of us came in contact with somebody that was a host. How come they got sick? I didn't get sick. So it's like survival guilt. You feel guilty, even though you had nothing to do with it. It's irrational, but you feel guilty. Then another way it actually shows, which is kind of counter to feeling guilty, is you begin to feel heroic. You feel like, oh, I'm invulnerable. Oh, I can help everybody. I can do everything for everybody. I'm not gonna get sick. I can't get sick. So you have that almost like a God complex, and you wear yourself out. You're the only one that can help. You're the only one that can bathe that person. You're the only one that can minister to that person. Not protecting yourself, not taking the precautions to make sure you don't catch the disease. Then another way emotionally when we're stressed out is after a while we don't care anymore. It's like kiss sera sera, whatever will be will be. I don't care. I'm not even going to do anything. Let the chips fall where they will. Or we get overwhelmed by sadness. Now some of the ways behavior-wise are crying frequently, just crying. For no reason, just crying, you have absolute, it's like you have no control over it. Having difficulty communicating, inability to feel pleasure. There's nothing. You don't feel pleasure. You don't feel anything. You're just no affect. Worrying excessively, wanting to be alone by yourself most of the time. An increase in irritability with outbursts of anger. Now you can see how this would be a problem when everybody is together 24/7. We're in each other's face, stepping on each other's toes. So when you begin to have that increase in irritability, it affects relationship. It affects marital relationship. It affects relationship among the children, between parents and child. So these are some of the behaviors, some of the signs of stress that we need to be on the lookout for. Next slide, please. Now we're going to talk about how to relieve stress. We have to keep things in perspective. We need to set limits on how much time we spend on the news, on how much time we spend listening to the reports. Like I said, unless you're essential services, we do not have any need for second per second updates. We don't need it. That's putting too much stress. We have to remember that the body is built that when it encounters stress, we get the fight or flight response. So even though you feel like, oh, I'm just watching, but your body is responding as though you are being impacted negatively. So your blood pressure is rising, your heart is palpitating, your shortness of breath, you're breathing rapidly. So you're actually putting strain on your organs. You're putting strain on your bodily functions. So we need to make sure that we take time away from the news. Let's focus on the positive in our lives. It's like I was on a prayer call with some friends yesterday, and I just said we should just take a minute and thank God for technology. Yes, we are doing I actually don't like the word social distancing. We're doing physical distancing, but we're still connected. I mean, can you imagine if we did not have technology, we had no way of checking on our loved ones that are in areas that they said 10 people have died, 100 people have died, and we have no way. So we're wondering, is it my parents? Is it my uncle? Is it my thank God for technology that we can video call. We can still see ourselves. We can speak to. There are things to be thankful for. Can you imagine if this happened before the advent of the cell phone, or when people didn't have access to iPads or personal computers? It would have been a nightmare. So there's some things to thank God for. So we need to focus on the things we can control, and the things that are outside our control, we need to turn them loose. There's nothing we can do about it, no matter how much we worry, no matter how much we stress ourselves. The next thing we can do to relieve, back to that slide, the previous slide, yes. Another thing we need to do is, yes, we want to keep up to date, but we need to find the people or sources of information that are reliable, that are accurate. Things like the CDC, the World Health Organization, those are the institutions that we should be getting our news from. Because the media is putting such a spin on everything. Everybody has an agenda. So we need to be careful of the news that we are ingesting, so that we're not just getting all the fear. In spite of all that's going on, I was listening to Dr. Fauci, yes, it was either late last night or right in the middle of the night. He was on Trevor Noah's show. They were doing it virtually. And he was talking about the fact that out of those who get infected, the mortality rate is 1%. Now that's high, but the way the media spins it, it seems almost like once you get the disease, that's a death sentence, So we need to be careful. We need to listen to reputable sources and not get the wrong information and get ourselves all stressed out. Next slide, please. So there's some other things that we can do to keep healthy at this time. We need to keep ourselves healthy. We need to eat healthy. We need to drink. We need to hydrate. Water. We make sure we get adequate water at this time. We need to avoid excessive amounts of caffeine and alcohol. Do not use tobacco or illegal drugs. Get enough rest. Get enough sleep. Get physical exercise. We can see some of the other things that are out there. One important thing is relaxation training. Now, you can go online. There are a lot of programs online where you can actually learn this. What it does is it helps you focus on a muscle group and voluntarily tense and relax it. And by the time you're done, you can feel relief from the tightness, because when we are under stress, our muscles tighten up, and that gives us headaches, gives us body aches, and just makes us uncomfortable. Another important thing is meditation. Meditation is very, very good for relieving stress. And prayer. Prayer is very good for relieving stress. Mindfulness, being careful, paying attention to what you're thinking, how you're feeling, the connection between the two, that helps. And then helping others. There's something about helping others. It gives you a good feeling. It makes you feel good. It relaxes you. So helping others, it could be somebody who's short on finances. You could order groceries or order something on that could food and have it delivered at their doorstep, or just help somebody in a way. You could sell money into their account. You could do things, just little things. Go drop some groceries at their door. Just things that will help even at this time. Like I said before, exercise, it must not be overlooked, because exercise releases hormones, feel-good hormones in our bodies. And then some other dietary supplements. So the next slide, when to get help. The next slide, please. So if you or somebody in your circle at this time is showing those signs of stress for several days or weeks, then it's time to get help. It's time to get help. Don't let it go indefinitely. It's time to get help. You can contact the National Suicide Prevention Lifeline. We'll show the numbers on the next slide. You need to contact them right away if you're feeling suicidal, or somebody's talking about killing themselves, or beginning to gather the means to kill themselves. So we need to really pay attention during this time to our kids, our teenagers, our elderly, because the news out there with the fact that they are the ones most at risk, there's a tendency for some of them to actually decide to end it all, especially if they start having symptoms. So we need to keep an eye on them. We need to, yes, we can't visit them, but we can video call them, we can text them, we can talk to them on the phone. Just encourage them even at this time. They need all the encouragement they can get. On this slide, we have a resource list. We have some numbers on here. Like I said, the sources for credible outbreak-related health information, the CDC, the World Health Organization, and there's some other resources on there, the National Suicide Prevention Lifeline, Behavioral Health Treatment Services Locator, and the Substance Abuse and Mental Health Services Administration phone numbers. So these are some resources out there that if you or a family member or someone in the house with you needs help, you can call. And some of these will actually talk to you on the phone. So they can talk to the person, or if it's you experiencing the stress, they can talk you through. They can do talk therapy and help relieve the stress. It's time for Q&A. You can put in your questions at the bottom in the comment section on YouTube if you have any questions with regards to the presentation.